program together?
I think it's a big need right now. What I see every day is I see a lot of people that don't have access to dental care. So it's kind of a passion of mine to provide quality dental care at an affordable price. And it's just something I feel that more people need to know about as far as just dental health in general and how your dental overall health can affect your overall health. And so it's one of those things that I'm just really, really passionate about.
And what exactly, if people come and attend this free event on Thursday, I believe is the day, what are they going to get? Are they going to get just an exam? Are they going to get cleanings, cavities filled, root canals? What's the deal?
Well, actually, we can't do all that at one time, but actually it'll be an exam, comprehensive exam. We'll be doing exams on kids, adults. We'll check for oral cancer. We'll do screenings for patients that may need dentures, partials. We'll also have someone on staff that'll do orthodontic or braces checks. We'll do all kinds. We'll do pretty much a whole comprehensive exam to really see what's going on in the mouth.
And those will be free exams. Now, what
free
is
exams. It's going to be free exams, no charge. We want everyone to come out. We're going to have water. We're going to have soft drinks. We're going to have a little food. We're going to have games. It's just going to be a really good time. It's going to be a time not only for to educate, but a time for just have a good time. Kind of enjoy being in a kind of in a dental setting.
What if you have the exam and you find someone who's got a couple cavities, or they do need braces, or they need a partial or a root canal? What do they do then? Because they're getting this for free. I'm sure they can't make that work for free.
Well, no. What we do is we've set up a nonprofit, so we do have some money allocated for free work. But basically what we'll do is we'll bring them in to one of my offices. I have 2 locations. And we'll set them up, and we'll, if they have insurance, then we'll work with the insurance. If not, then we'll set something up. We'll do payment plans. We have different forms where we can make it affordable for these people to pay for their work.
Okay, so a lot of people hear things like that, but I mean, tell me kind of what kind of guarantees, if you will, that people, because sometimes that makes people not want to go. They go, oh, well, it's just an exam. If I got a cavity and I know I do, they're not going to help me. It's still going to cost me through the nose. So what kind of things are you going to be able to provide them?
Well, once again, I have to sit down and I'll assess everything, and then I'll do payment plans and things of that nature. We'll put stuff in writing. We have care credit, and like I said, we do have some money allocated for certain individuals that may qualify for actually free work. So these are all the things that we're putting together right now. Once again, I don't want to make people. I want to make people know that they can come in and they can get the work done regardless of how much money they have or their situation. Because at the end of the day, we're here to help, and I'm looking to help the community. So I'll do whatever I can to make it affordable, and that's my main goal.
Okay, and what is the nonprofit?
Star Smiles Foundation. It's just a foundation that I founded. And actually, we're accepting donations. And the bottom line is that the money allocated to the foundation is used to help people with their dental work. So I think it's really, really big. I think I'm really excited about it. And as it grows, then we can provide more services for people.
And every dentist you meet obviously is going to have some sort of passion for dental health. But it seems like your passion may be a little bit different. You really do have a concern for the people out there who aren't getting what they need. Where did this come from?
It just came from kind of where I grew up at. I grew up in Michigan, Detroit area, and I saw a lot of people that were underserved. Then I did a residency in Brooklyn, New York, another underserved area. And then I did my pediatric residency in the inner city of Detroit at Children's Hospital of Michigan. So in the midst of all that, I saw a lot of people that had hardships, and I saw a lot of really bad things. And since I've been doing this for a long time, and I've treated thousands and thousands of patients, I really have a chance to, listen to people. And I know, to have a bad toothache or to have an abscess tooth is a nightmare. It really is. It's something that can make a grown man cry, and it keeps people up all night. My passion are kids, of course, because I did my pediatric residency. And so I'm really passionate about kids per se. I don't want to see a kid in pain. Anything that I can do to help, as far as my expertise, that's what I've done to do.
And so you said you've lived in a lot of places and worked in a lot of places that there was noticeable hardships seen. Are we in that boat here in Las Vegas?
I think so. I think the economy as a whole, there's a lot of people that don't have dental insurance that are going through tough times and they don't have access to dental care. So I think really we're kind of in that situation right now. Right now, I'm in surgery several times a day because we have so many kids that come in that have just really, really bad teeth. You know, a lot of it is contributed to the bottle. So I'm very passionate. It's baby bottle tooth decay is what we call it. And I urge all the parents, you know, when the kids are one, get them off the bottle. Don't put the kids to sleep with a bottle, whether it be milk, juice, whatever it is. I mean, if you're going to put them to sleep with a bottle, water only. And, you know, I really urge that because what happens is that bottle, the milk or juice in the bottle has a substrate that will, the bacteria in your mouth will feed off of that. And this is how their teeth end up breaking down. And I see a lot of really bad situations. So really, I think it's preventable. It's something that, even though it's treatable, it's preventable. And you know, put a kid through surgery and so on and so forth is really not something that's necessary if the parents just take if they become proactive.
Is baby bottle syndrome or whatever we're calling it, is it creating a lot of tooth decay where the teeth need to be pulled, or
Absolutely.
is it with the bite?
It's creating a lot of problems where the teeth need to actually be pulled or capped. There's a lot of problems that go along with it. You know, the kids are waking up with abscessed teeth, swollen faces. You know, even in my residency, we had a few older people that had died from an abscessed tooth. It's really serious. You know, it can get up in the brain and get in the bloodstream. Not to mention, it can affect your overall health. So at the end of the day, we really, you know, the mouth dictates how your overall body feels. So.
And how common would you say it is? Like, is 1 in 3 patients, 1 in 5 surgeries? How common is it?
I would probably say out of, if I see 10 children, I would probably say 1 out of 10.
Wow.
Yeah, I would say it was that prevalent. 1 out of 10 probably need to go to surgery. Maybe 5 out of 10 or 6 out of 10 actually have cavities. So it's something, once again, it's something that can be preventable. It's just it just takes a little bit of time, brushing twice a day, kind of watching what they eat, drinking a lot of water. There's a lot of things that you can put into place. Sometimes I like fluoride rinses that you can buy over the counter, ACT. These are all things I think that can help aid in the decline in tooth decay.
Awesome. We'll get you with the patient and then we'll be out of your hair.
Sounds good.
Get you to surgery.
Thank you.